welcome back. My name is Connie. This is MzansiOz Diary, Justice Unmuted. We are continuing with our story from South Africa about free public health care access by foreign nationals in South Africa, many undocumented. Yesterday, I played a video of Zimbabwean Human Rights Commissioner Jesse, who was interviewed by Newsroom Africa. In that interview, she made a lot of insulting statements and a lot of claims. Now, it turned out some of them were false. Let's listen to it.
Now, the Zimbabwe Human Rights Commission is working with South Africa's public protector advocate, Koleka to deal with complaints that Zimbabwean citizens are being turned away from public hospitals in the country. This comes after several reports showed that some hospitals are refusing to treat not only Zimbabweans, but indeed foreign nationals at large. The Zimbabwean government has also said it will not pay for its citizens to get medical help in South Africa. The Commission's chairperson, Jesse Majome, emphasized the need for Zimbabwe to improve its healthcare system. And she joins us now for more. Jesse, thank you so much for the time. Really appreciate it. So let's talk about the meeting and the engagement then with the public protector, Advocate Koleka there as well. What's that conversation been like and what has come of it?
The conversation with my counterpart, the South African Public Protector, Advocate Koleka, it was to show our mutual interest in having our countries beneficially resolve the issue of the conflicts that are arising when Zimbabwean nationals approach South African hospitals to seek services. This conversation is actually not a new conversation. In September 2024, the South African Public Protector, Advocate Koleka, very graciously hosted my commission, because the Zimbabwe Human Rights Commission has a dual mandate. It is the National Human Rights Institution. It is also the Public Protector Institute. So she graciously hosted us for a benchmarking and learning visit, because we came to learn how the South African Public Protector conducts its mandate and overcomes difficulties that it encounters, so that we can also grow and improve our function. And in that visit, Advocate Koleka and myself had a conversation that started about that problem that's in the media a lot, about Zimbabweans seeking help. And we agreed that we want to come together and devise ways of coming up with lasting solutions, like what I can call a root cause approach, to ensure that Zimbabweans, like all human beings, and all as South Africans who are in South Africa, also enjoy their rights freely, because there should not be conflict around this. And we've just finished a round of the public, the learning visits, because we started with South Africa, then we went to Kenya and Uganda. So we have just synthesized the outcome of the visits, and so it is now time for us to resume that collaboration, because it was a very good engagement where we are in agreement that we need to see if we can find each other. So what we now need to do is to conclude that. But the good thing is that we agreed that for the benefits of our countries and for the nationals of our countries, it's not a problem that cannot be resolved, but that is Southern African states who are neighbors, and who are Africans, all of us, we can find lasting solutions to de-escalate this very unfortunate and needless and avoidable issue where human beings across required to have their dignity and their rights respected, but also right round, because human rights they impact the rights of others as well.
Jesse,
So, what is false about what you just listened? First, the South African Public Protector, the PPSI, released a media statement. And a media statement, I'm going to put it here so you guys see that statement. The key points that statement raised were the following. Number one, there is no formal complaint filed. So the South African Public Protector states it has no record of a complaint launched by the Zimbabwean Human Rights Commission regarding Zimbabweans being denied healthcare in South Africa. Number two, the South African Public Protector says that the visit that she referred to in this clip was for benchmarking, not complaints. The Zimbabwean Human Rights Commissioner's September 2024 visit was a benchmarking initiative, not a formal engagement about access to healthcare for Zimbabwean nationals, because this issue wasn't there last year. Like I said, the issue stemmed from those tablets we're seeing being in the bus en route to Zimbabwe when the Border Management Authority in South Africa stopped a bus that was en route to Zimbabwe. And in that bus, they opened boxes and some suitcase, and they found that there were medication, that Schedule 4 medication and 8 medication that were in that bag. A lot of them had been dispensed in South African clinics, the very same clinics when you've seen the uh, the the civil society like Dudula and Women March on March standing and requesting identification. So this issue wasn't there last year. So her claim that they had discussion about public healthcare access in September 2024, or I was looking into that to see whether that was true, but then the South African Public Health Protector refuted those claims, categorically refused them, because this issue wasn't there last year. This issue that by Dudula at the time. Now, the third thing that the public protector also alluded was that no discussions about denial of health care. Like I said, there was no issues about that last year. And even this year, the issue this year is not even hospital, is to do with the primary healthcare access, where these people go for doctor shopping for medication, specific medication. This is the issue here. So she's saying that no, there's no discussions about denial of health care. At no point during or after the visit did the topic of Zimbabweans being denied access to health care in South Africa come about as a formal issue. The fourth thing that she also made it clear was the focus was internal reform in Zimbabwe. The South African Public Protector shared materials to help the Zimbabwean Human Rights Commissioner improve its ability to investigate corruption within Zimbabwe, including Zimbabwe's healthcare system. The fifth thing that the South African Public Protector said in disputing this claim was that she was surprised by the media misrepresentation. The South African Public Protector expresses surprise at media's reports suggesting the two institutions discussed healthcare discrimination in South Africa and calling it inaccurate. But then the public protector is actually, instead of actually saying the Zimbabwean Human Rights Commissioner is lying or misrepresenting the facts, she's avoiding that by going after the media. But we can hear the clip from the horse's mouth that is actually from the Jesse Human Rights Commissioner that said that. Yeah. Why did Zimbabwean Human Rights Commissioner lie? This is a very serious question, and this question is around institutional accountability. Was Jesse Majome trying to preempt exposure of trafficking networks linked to Zimbabwean interest? What do I mean is that those medications that I said before, and I think some of you might know, I have a dual degree of pharmacy and pharmaceutical science. I work in both areas, so I saw some of those medications that were sent to me. I had a look at them. So the question is very simple. Was Jesse Majome trying to preempt exposure of a trafficking networks linked to Zimbabwean interest? Could this false claim that she made about South African public protector have been a cover narrative to delegitimize Dudula and March before broader trafficking networks were exposed? And this is linked to our main man. Why I'm still asking this question to all of you South Africans. Who is Vusimusi Cat Matlala? And I'll leave it there to you. These two issues here about this foreign national and the public health access that don't have documents and the history of trafficking, of doctor shopping, clinic shopping, aka medical center shopping, and the evidence we were shown by the BMA when they stopped that bus that had those medications in there, and the people who were upset about the actions of Dudula, who were doing nothing than asking people to identify themselves when they attend these clinics, and to have to demand a valid whole South African Home Affairs issued identification for anyone that attend those primary healthcare setting in South Africa, which are nearly all of them in the Bantustan, formerly known as Bantustan in apartheid era South Africa. They are called townships. They are Black South African community clinics. And historically, those communities were denied access to healthcare, public healthcare under the apartheid law, and the healthcare system were underfunded. And I am still asking that question. It's a very serious one that you guys need to think about this question. Could Zimbabwean Human Rights Commissioner have lied in order to make this false claim so that this to act as a cover up to delegitimize the very important civil group in South Africa, Dudula and March? Because now this Dudula March as demand for identity will make it harder for people who are claiming to be illegal immigrants, undocumented, to claim to go and access this facility and to go and doctor shop for these medications that they are after to make the recreational drugs that have been reported in this community. This is a question. I haven't made any allegation for anyone. It's a very serious question. But the key person we're still asking, who is Vusimusi Cat Matlala? Thank you guys for listening. If you're new here, please consider subscribing. Until next time, see ya.